coronavirus protocols and safety guidelines are key for businesses as they start to open back up, at least until a vaccine is found. And my next guest has been tackling the issue from both sides, working as part of the Mass High Tech Council's Executive Committee on Workplace Safety Protocols that he's now put before the governor, and as part of what the Wall Street Journal called the secret group of scientists and billionaires pushing a Manhattan Project for COVID-19. Steve Pagliuca joins me now. He's also co-chair of the private equity firm Bain Capital and co-owner of the Boston Celtics. Steve, it's good to see you. Thanks so much.
Great to be here, Jim. Good to see you.
So what do you think of the governor's path out of this today? How would you grade him?
I give him an A. The governor is in a tough situation. This requires patience. And as he saw, the indicators are not all green yet. Number of hospital deaths, also, they're stabilizing, but it's not totally there. So he's taking a cautious, iterative approach, and he can always make that go faster. It's hard to make it go slower if you start out too quickly.
But it seemed that, well, today, with maybe one exception, the houses of worship, which I want to broach in a minute, is quite cautious. It seems starting a week from today, the pace is picking up. You co-wrote a piece in the Boston Globe saying that public leaders should depend on data, not dates. We haven't met all these guidelines about downward trends, even though there are some good signs. So does that not trouble you?
No, it doesn't trouble me. I think we've met several of them, and they're going to monitor them, and they're starting out slow. And in a week, they can look what happens next and just play it card by card. And again, it's much harder to pull it back than it is to speed it up. And the issue is, if you go too fast, and you have a situation that overwhelms the hospitals, then you're going to have to shut down again. So you don't want to see rolling shutdowns as you've seen in some other countries.
Would you have opened up houses of worship on phase one, on day one? 40% of people who go to a church or a synagogue. Does that sound good to you?
Look, that's not my call. That's a public policy issue. And they had a commission go out and talk to the public. And they're opening up with a modified, with social distancing, with masks, with all the protocols.
So have you seen, I'm going to put up some of the visuals this weekend were just so upsetting to me, and I assume lots of people around America at beaches and bars, and you focused a lot on the responsibility of businesses and the governments that oversee those businesses. But do you think the American people are grown up enough to continue to do the kinds of things Charlie Baker said they had to continue doing for this reopening to be successful? Look at this.
Yeah, no, it's concerning for sure. The whole issue with this disease is the RT factor. That's the transmissibility of it, mm-hmm. and the deadliness of it for certainly people over 60. So really, the worst thing you can do is going into crowds, not wearing a mask, and you're going to see another recurrence. So far, people have been pretty good in Massachusetts. At least that's been my view in Massachusetts, and I hope our citizens will be responsible. Again, I always say, don't be. It's not good to be mad about the plan. It's good to be compliant. If we're compliant, the plan is going to go quicker. If we're not compliant, you're going to have rolling shutdowns.
One of the pieces that Baker announced today was offices, 25% capacity, not Boston. Boston is a week away. I know you've thought a lot about what an office of the future being now, will look like. How different is it going to be other than just the number of occupants of that space?
Well, it'll be very different because even within the office, we're encouraging people not to have meetings in larger groups than 4 or 5. You want to really do the same social distancing, wearing masks inside the office. Uh-huh. Again, the way to stop this spread, the most effective way is to wear masks so you don't have spread of the particles, and to do the social distancing and try to stay out of groups. So yeah, it'll be a very different office. It's going to be less people and less interactions, and maybe larger meetings will have to be on Zoom, even if you're in the office.
Do you worry about some inequities resulting from this? I mean, the governor has gone out of his way, and I think he's right, to suggest that those who can work at home should work at home. But I think it's fair to say that those most able to work at home are people who are not on the wrong side of most of the inequities in the society, but those who do have to go to a workplace are. How do you address that kind of thing?
It's very hard. I think you need social programs and unemployment programs, and really got to support those people. The terrible thing about this pandemic is that it actually has impacted those that can handle at least people on the front lines, people distributing goods, people in hotels, people in restaurants. That's a real problem with this disease.
One of the things I read when I think it was the high tech report, it focused on two issues that as a layperson seemed to be pretty important to me: childcare and transportation. On the transportation front, the governor said, stay the course for phase one, the Saturday level. We'll pump it up a little bit in phase two, and then even more in phase three. On the childcare front, he talked about how we have not reached the current capacity. We're roughly at a third. But it seemed to me on both fronts a little more vague than one has to be when returning workers are so dependent upon both those things. Did you share that perspective or no?
Well, I think it's going to be up to people to manage that travel, and if a train is too crowded, you really can't get on it. Employers have to understand that, and they're adding more cars, and they're having a kind of schedule to try to accommodate it. So anybody that can take alternate transportation, or make sure you're not in a crowded situation, or have masks on. It works very well in other countries. We do a lot of business overseas, and I've already had meetings where there are people in Japan in conference rooms. They all have masks on. Japan has a big mass transit system. They haven't had a huge RT factor with this virus yet because they're wearing masks and they're observing those protocols.
Speaking of overseas, is there a country that you tell people should be looked to as a model of how to handle this? I don't mean from the beginning, because it's too late for the beginning. From the stage that places like America and Massachusetts are. Is there one, or are there several?
There's several. The Asian countries who had gone through SARS were more prepared for the pandemic. Now, look, we don't have the same system they do, so they've come up with very strict lockdown systems, some things we can't do here socially. They have tracking capabilities, so they're much more effective in the testing and trace aspect as well, because they can tell from a cell phone if I've walked by and talked to 100 people, they know who those people are. So we have to follow some of those models. We're going to follow them completely, but there's enough here with wearing masks, distancing, and doing strategic testing and tracing that we can beat this thing.
So you gave Governor Baker an A. What would you give President Trump, Steve Pagliuca?
Again, I'm just here. It's about data, not about politics. I'm not running for anything. And I just hope all levels of government can cooperate with the private sector and with the academic sector and scientists, so we can kind of get this thing solved. It's clearly the worst crisis. I never thought I'd see something like 2008, but this is, has aspects of 2008, but even worse because it's a medical disaster as well as a financial disaster.
Well, let me try another route to the same place. Is there anything the federal government has gotten right based on the work that you and your colleagues have done?
Well, yes, the federal government has done a lot of things to help pharmaceutical companies in terms of the vaccine. They put lots of money. They put $439 million, for example, into Moderna. Moderna has announced some preliminary, but very good results from a trial today. The FDA has done some fast-tracking things to allow things like remdesivir, be manufactured. So, yes, I think that they've converted from a peacetime operation to what I'll call a wartime operation in terms of approvals and emergency authorizations for new drugs and things like that. So that's been very helpful.
I want to turn briefly to your other hat for a second. Here's the president calling in to NBC Sports yesterday during, I think, the first golf event of the new era. Here's the president.
We really want to see it get back to normal. So when you have all of those thousands, tens of thousands of people going to your majors and going to golf tournaments, we want them to have that same experience. So we don't want them to be having to wear masks. We want to be back to normal where you have the big crowds and they're practically standing on top of each other and they're enjoying themselves.
We're not going to be seeing those kinds of crowds, maskless, cheering on your Celtics anytime soon, are we?
No. The number one thing until we have a vaccine or therapeutics that effectively stop the huge health issues we have here is not to be in large crowds. And so being with 20,000 people is not the thing to do, being in any kind of crowds. And so this whole process has to be social distancing, wearing masks, minimizing crowd experience. The spread factor is 2.5 to 1, so you can spread it to 3 people. But actually what happens is if someone goes to a meeting with 1,000 people, they can affect 150 people. So that's just an area rife with problems.
Steve, last thing, you've mentioned several times not wanting to be in a position where a leader would have to shut down that which he or she has already reopened. Do you worry about the other thing, that even if numbers suggest that there should be a reclosure of something, that the pressure to open and stay open is going to be so intense that we're going to get ourselves in an even more difficult predicament?
Well, what I'm hoping is that we will have therapeutics like remdesivir, like other ones they're working on, coming online in June, July, August, that will by definition lessen the pressure on the hospitals, and that we'll have enough people observing the mask and these procedures, so we won't have that happen.
Steve, thanks for your work. Thanks for your time. See you soon.
Great to be here. Great to see you.
Steve Pagliuca, thank you.